know several of you have mentioned the test that the world has been through in the last few years, a global experiment on who we prioritize regardless of rank, race, or resources, how equitably we look after each other. You mentioned equity, Dr. Tedros. I think we can all agree that we might have failed that test. That test was COVID-19. I remember during COVID, I spoke to a nurse in Nairobi who was working in a health clinic in one of the informal settlements. She said that it was at a time when rich countries were giving children their second dose. No health worker in Africa had even their first dose of the vaccine. And it was not only unconscionable, but it was just stupid health policy. I remember her saying, our lives matter too. So I wonder, how do we make sure that that kind of inequity, and vaccines were only one part of the problem, never happens again? Katherine, do you want to start us off? Question for you.
I thought relate with the nurse in Nairobi because I had to tweet and say I must get vaccinated because I'm going crazy. And there was a whole operation to get me my first dose of AstraZeneca. And so it's what it is. And I think for me, a lot of what we're doing right now as an organization is to sort of respond to that. The fact that in a global crisis, really like the world moved on like we didn't exist. And so you do ask yourself, okay, are we going to expect the world to be there in the next 15 years from now? And so that's the thing, some of the solutions actually lie in different regions of the world developing their own capabilities. It's not that everybody should manufacture vaccines, but they should have the investments in the technologies that 15 years from now are going to give us a vaccine that is everywhere. So every country, every region doesn't need to depend on the global system that clearly did not work for all of us. So there's a lot that could be done, that could be said, but I think part of the way we can achieve equity is to ensure that there are capabilities in all regions of the world to do the science.
Bill, do you want to touch on that issue around inequity? You spend a lot of time on nutrition, which has the possibility to level the playing field for so many who get it right.
Yeah, well, the inequities is fascinating to me because, you know, the world is very inequitable. Before COVID comes along, you have 400,000 kids dying of malaria in Africa and very few in the rest of the world. But that doesn't bother people, you know, that's not a headline, that's not a thing. Then when we get COVID, you know, which largely was very much targeted at older people, people are, oh, now we're going to pay attention to this. You know, ideally, it's not just during crises that we look at the deep level of inequity that's there every single day. Nutrition is just a fantastic example of that as countries improve their nutrition, you know, we see amazing effects. We see educability get a lot better. We see height grow up. We see TB largely grow away because of diet effects. You know, New York City used to have the highest TB prevalence of any city, more than even, say, the cities in South Africa have today. And there wasn't some magic antibiotic solution to that. It was very much about diet. And so there's a lot we know that we can do on diet, but it's this research that really is getting some impetus now. And that will include low-cost interventions. And we know there are high-cost interventions. If you give very rich protein diets to kids, eggs, meat, milk, that's very helpful. And we should do some of that, but it's not as scalable as if we can come up with even lower cost interventions. So, hopefully we're holding ourselves accountable for the day in and day out inequity that is so tragic.
Dr. Tedros, if we go back to lessons learned from the pandemic, talking about the pandemic agreement, how is that going to ensure that those inequities will not be there in the face of another pandemic?
Yeah, thank you. I think I fully agree with Bill that inequity has been there, and it shows in many ways. The only thing probably COVID did is it exposed it. Otherwise, it has been there. And the equity is now at the center of the pandemic agreement. And what member states are now saying is equity is central, and how do we operationalize equity using international law. And that really could help if equity could be addressed, because as you shared the story, I would be happy to have the story so I can share it with the member states who are now negotiating the pandemic agreement to remind them. Of course, there are many stories like that, but addressing equity will be at the center of the pandemic agreement. We have various articles now. The agreement is shaping up well. And Article 12, the PABs, the pathogen access and benefit sharing, is actually where we have the equity as well. Of course, equity can be addressed, one, by increasing the global production capacity. And that's why, with partners, we have established the Technology Transfer Hub in South Africa, and also the training center in Korea. And countries like South Africa, Argentina, Brazil, India, Bangladesh, Indonesia are participating. This is big capacity countries, and in Africa, not only South Africa, we have countries, other countries also participating. Of course, that needs a commitment of the government, the private sector, and so on, in order to make that happen. But the other element is, of course, the strategic solution is increasing global production. The second part is we never know when the next pandemic will hit. Sharing is very, very important. And sharing not only for COVID, as Bill said, I fully agree on others too. As the saying goes, sharing is caring. But not only that, sharing also is in many countries, national self-interest as well. Because it's when everyone is safe, we can be safe. We can protect ourselves when we protect those who cannot protect themselves. And that's why in the sharing, it's not just caring, there is also the self-interest, national interest of the other countries, to protect themselves as well. So that's why we need to share if the next pandemic, not only pandemic, but the other health problems that we have as well. Maybe one problem I can mention here, just 1 minute, is when this pandemic hit, I spoke to a minister from a high-income country. And our suggestion, WHO suggestion was, okay, vaccinating elderly people and people with comorbidity is okay. But please, before vaccinating children, please allow the vaccines to go to low-income countries to vaccinate their elderly and people with comorbidity. That was the problem. And that was not well accepted. And the other is, there was deliberate hostage because many countries didn't want to be blamed for shortages, but they didn't mind to be blamed for excess and wastage. And it was a political decision. So if you see this, each and every government should make a commitment to at least address these two issues. Meaning, it was possible even during this COVID to share, but there were things that they considered that really go against sharing. And I hope with the pandemic agreement, this will be addressed. We have now a balanced text already tabled, and I hope there will be a deal. But countries should be willing to continue to give them.
Right, and as you say, sharing is caring, but sharing is also culture change, right? And what you've brought together here for this conference is also part of that culture change of having people together, working together. So if you could, let's give a task to everyone who's come here. What's the question that you think people should be answering whilst they're here to get that cultural change that Tedros has just been talking about?
Well, first of all, I think we realized after these discussions and even before that you need everything from public, great academic and clinical science to go hand in hand with the innovators, those that can actually break out of universities or do small startups or even more established companies, that it's a full value chain where we each have to identify where do I fit in this giant jigsaw puzzle that all in all is the polycrisis we're talking about, and where can the things I'm good at or my organization is good at contribute to the whole chain not breaking, but maybe at the end of the day making it all the way to a solution. So I think about what are individual organizations' ability to contribute and where are we best, and then focus on that and go out and work with the rest of the value chain.
And what will that mean for people in terms of opening up, of being in a different sort of competitive environment with each other? What's the cultural change that people need?
But I think if you look in agriculture, very often, as we also have heard, it's not such a big issue because there's very often a tendency that if you do some innovation that you can breed a better seed for new grain and so on. That is actually widespread. But the problem is, of course, when you move into other areas of life science, people are so worried about patent protection, this, that, and the other. I think we have to see it a different way. There are areas of clear competitiveness where, of course, you as an organization, if you're a private industry, have to focus on getting it right to make your shareholders happy. But at the same time, there are so many things you can do, even as a private industry, that are pre-competitive, but that can be giving the, let's say, other organizations, including, philanthropy, including the public, an edge that they can go further to the next step. So be able to better dissect out where do we have to focus on protecting our own, and where can we really share what we have in terms of competence.
Right. Interesting. There was a line that Dr. Tedros mentioned, cigarettes and sugary drinks manufactured in one country cause disease and death in another. And we've talked about the private sector. Bill, I wonder if you could address this. How do we bring them in more on this journey to look at nutrition in the way that you do in terms of increasing not just people's health, but their productivity for their own countries?
Well, in medicine, over the years, including some misdirection, there is now a basic framework that there's tiered pricing. That is, the high-income countries take most of the responsibility for generating the return on the profit. The middle-income countries less so, and the lowest-income countries are getting access to medicines at essentially the cost to make those medicines. So that tiered approach, which HIV medicines were the one where that got pioneered, that's worked out incredibly well. So, every time we have innovations, we have to think, okay, how can we apply that and make sure that the returns are there so that the R&D is continuing full speed, and yet we also at the same time, for the poorest, are providing great access. In the food area, it's less clear. There's some things that can be done with taxation on sugary drinks. There's some things that can be done on education. There's some ways that drugs can help with actual satiation. So we're going to need quite a mix of things. It's been very difficult to influence behavior in that case. There's no country that broke the obesity increase trend. And so when we always want to look for exemplars. When one of the rich countries gets that right, great. We should spread those policies around the world.
Thank you. And finally, Katherine, you're a strong advocate that Africa must be in the driving seat for solving the solutions. And you're sitting here on a podium with three of the world's most important, influential men, I will say. What do you want from them?
Break us a check or something. No, I think what I want from them sort of revolves back what I said earlier, that we need to invest in local institutions, and we need to invest in how science is done. There are great innovations, there are breakthroughs, but we need to invest also in how they get translated into real life. So institutions, people, proximate partners, and then translation.
And many of them have said they are listening here. Are you seeing that?
Yes, they are. Yes, I mean, I think when I saw the announcement, I was like, this is amazing, to be honest, and having been in this space. So I'm hoping that this is the beginning of a long partnership. In my place, they say, if you want to go far, if you want to go fast, you go alone. If you want to go far, wait for people and go together. So I'm hoping that this will take us much further than any of the individual foundations we have done on their own.
Fantastic. We've heard some great solutions already here today. We'll be building on those over the next day and a half, and we invite you to stay with us. We'll be taking a short break here. We'll be back at 3:30, so we'll see you all then.